So, ang phase 1, inpatient, may level-level. So, level 1, if ang patient nyo na ICU, na intensive care unit. Okay? ICU is intensive care unit. So, for intensive care unit, no, isa na siya ka-area wherein ang mga patients nyo, tululupan na sila, may mga cubicles lang. So, usually, sa intensive care units, damo-damo machines ang naka-attach kay patient. So, to start, no, ang rehabilitation process sa ICU, dapat si patient stable. When we say stable, ang iyang heart rate and blood pressure, wala naga-fluctuate. Also, ang iyang mga CK and troponin level sa iyang blood works is normal. So, wala na siya sa myocardial injury and they are back to normal. So, rehabilitation starts after 24 hours or after 24 hours that patient is stable. Okay? So, what are the activities that you perform to the patient sa phase 1? You can perform ankle pumping activities. So, higda lang sa patient and then you ankle pump ang iyang ankles with dorsiflexion and plantar flexion. Kung alert si patient, no, you can perform deep breathing exercises. So, mag-perform kita deep breathing exercises. We ask the patient to inhale through the nose and exhale through the mouth. Tapos, dapat ibantayan tagid if there is an increase, no, sa size ng diaphragm ni patient or sa iyang stomach. Okay? Para mabalaan ta if deep gid man ang breathing niya. And then, we can also teach the patient, no, to use the commode if kaya niya na mag-sit up and mag-stand. Usually, commode sa kilid lang man sa iya bed. But sometimes, no, sa mga ICU patient, may ara lang sila nga daw, ganit niya. Though, dako lang na siya nga basin, no, nga ginabutang lang na sa dalom sa ilang nga bed. Okay? And, limited personal care. So, anong mga personal care nga kaya nila obrahon? So, pwede mga mga brush siguro sa ila hair, no? So, very, very limited because hindi sila pwede mag-perform sang more than 1 to 2 METs. Okay, for level 2 naman, so, could be si patient, no, transfer out na from the ICU. May own na siya nga private room. So, you as a therapist should be alert to signs of orthostatic hypotension. So, orthostatic hypotension, again, happens when si patient from a supine position, gingulpi siya upright. Okay? So, that's why we perform mga, exercises, no, sa may, term, sa tilt table. Okay? So, there are tilt table exercises before, tas siya, orient sa standing position. So, para ma-lessen ang orthostatic hypotension. For what if I miss, hindi available ang tilt table? So, usually, ang bed sa patient, no, na siya, move up and down. So, pwede na gamiton mo para ma-reorient si patient. Para hindi siya magka-orthostatic hypotension. So, di ba, when we try to orient the patient in an upright position, nubo ang iyang blood pressure. That's why orthostatic hypotension happens. So, what we can do also kay patient, no, if napapungko na siya, we can support the patient's feet with the stool. So, hindi na siya pag-ipa-dangle to assist venous return. So, the patient can walk to the bedside chair. And then the patient can sit in an upright chair for up to 30 minutes, a few times a day. So, hindi siya pag-ipadugayon. Ganyan, let's say, for example, balod na siya nga, sige ma'am, bilin ta ka mo, no, after sang rehab nyo. So, dapat, after 30 minutes of rehab, sa phase 1, level 2, pabalik kong tagin si patient higda. Okay, and then pagkahapon, so pwede tayo i-instruct ang ilang folks, ang bantay niya. So, as much as possible, no tabletop activities yet. So, mga sa hands, like feeding or self-care, so bawal anay. So, for a patient, no, with a large myocardial injury, so reclining chair, so wheelchair siya nga nag-recline, so pwede mo siya mapasaka abo kadalom. And then the exercises that we can perform kay patient, no, pwede kita perform saya ankle pumps, knee extensions, and march in place. Dili sa kay patient, if kaya na ni patient mag-move sang iyang ankles, we can do this active. If not, pwede active assistive, pwede passive. Okay? And of course, very important, vital signs monitoring, especially for your heart rate and then the blood pressure. Okay, so level 3. Level 3 sa phase 1, there is a gradual increase in ambulation. And this should be measured in time. Okay, so mas mas easier siya if maghambal ka. The patient ambulated within the room for 5 minutes. Okay, so 5 minutes siya nga nag-walk lang. Okay, however, mag-document kita, it's very important to put the distance. So, mag-exercise kita, hambalon mo lang ya kay patient, ya time lang. Pero magsulat ka na gani sa iyong mga chart. Dapat butang mo gid ang iyang distance. So, let's say, for example, for 6 minutes, na kaya ni patient mag-walk for 500 feet. Okay? And butang mo man also ang iyang rate of perceived exertion. So, nagamba si patient nga, para sa akon, it was just 10. Okay? So, muna siya. And of course, at level 3, patient education is a must gid. So, ano mga risk factors for CAD? So, if we are overweight, increase ang aton yung mga cholesterol levels, no? So, those are coronary artery disease risk factors. So, for this patient, no, for level 3, usually, hindi pa na sila as alert and attentive. So, kung may ara ka mo mga pamphlets, no, about education, so siguro, sa mga sa mga cardiac rehab facilities, gidya gid, specific. So, may ara na sila guro mga pamphlets. So, it's very good option wherein you can give the patient time, no, to process ang mga kailangan niya i-modify sa iyang lifestyle. And of course, you can use your Borg RPE scale when monitoring activity intensity. So sa phase 1, level 4 to 6, so ari, manug-discharge na si patient. So you can gradually increase the frequency and time. So your goal here is to progress the walks from 2 minutes to 5 minutes to 10 minutes. So amat-amat lang, hindi nga paggulpihon mo. So the stairs can be climbed with foot over foot at a time. Hindi siya dungan nga pagka-step isang right, ang iya nga left ma-step naman sa next nga sa next nga level. So dapat pag-step sang right, pag-step man ng left, pero at the same level sila. Okay? So pwede nyo na siya ma-perform. And then you can also have the patient perform a variety of trunk, arm, and standing leg exercises for a few repetitions. So pwede mo siya mapa-perform sa mga flexion, extension, abduction, adduction, horizontal adduction, horizontal abduction, mga arm exercises. Okay? So, diri, better because it's still phase 1, hindi ka lang anay maghatag resistance exercises. So, arm lang anay. Okay? Because in this phase, nagapaayo pa lang ang patient. Kumbaga, ang wound healing sang iyang heart is not yet sufficient to perform resistance exercises. So, arrow lang anay. Pero you can increase the repetitions. So, pwede na siya nga, sige, for this, session, pwede kita let's say, for example, 20 repetitions. So, 10. So, una na 10 repetitions, and then rest, and then another 10 repetitions. So documentation, very important, and then actually I think you have a clinical documentation man nga class, but of course nami siya kay i-discuss ko na nga daan, so later on hapos na lang para sa inyo when you have a cardiac case. So objective data, you should always put the time period, anong duration sang inyong activity. So let's say, for example, ambulation, and it took you 5 minutes, okay? And then the distance. So ang distance, nga cover ni patient, lang, 20 feet, okay? And pwede man type of activity. So pwedeng ambulation or nag-sit lang si patient. So let's say, for example, level 2, long sitting position si patient for, let's say, 30 minutes, butang muda. And then standing exercises, pwede man, butang muda nga patient perform sit to stand exercises for 10 repetitions with rest at the 5th repetition, or rest in between, no? Butang nyo da. And then, stair climbing with number of steps. So, for example, level 6 ka na kay patient. Butang mo da, patient perform stair climbing activities with completing 5 steps up and 5 steps down. Okay, number and duration of the rest. So, very important yun kung ibutang mo ang rest period ni patient. Actually, ako, sang una, when I do documentation kay patient ko ng, let's say, sitting. So, naga-sitting tolerance kami kay patient. So, butang ko na sitting tolerance, no? So, don't try nyo lang intindihan ako nagi sa computer, guys. So, sitting tolerance after 5 minutes. So, after 5 minutes, butang ko da ang heart rate, BPRR. And then, butang ko pagida after 10 minutes, and so on and so forth. Okay, hasta maka 30 minutes ka. And then, of course, hindi mo gini dapat pagkalimtan is the patient education and the response of your patient, family, and caregivers. Yeah. Okay. So, last, no, before we take a short break. So, home exercise program. So, after level 6, no, nang na-discharge na si patient from phase 1 sa iya cardiac rehabilitation, you need to educate him nga dapat ma-recognize niyang symptoms if nagaka-angina naman siya liwat or there is ischemia that's happening. So, just i-review mo gid sa iya nga there is pain sa substernal area, nga it could refer, no, to other areas such as your left shoulder, left jaw, pwede man sa back, and then you can also inform the patient if he's experiencing dyspnea or SOB, fatigue, weakness, no? So those are the signs, no, nga dapat niya i-watch out. So for home exercise program, for the first 4 to 6 weeks after the myocardial injury, the goal is to complete 20 to 30 minutes of ambulation 1 to 2 times per day. So dapat in a day katuway siya mag-walk, amo gini dapat ang iya nga goal. Okay? And then of course, you can have the patient do some rest and then low-level activities such as your ambulation, lower extremity, and upper extremity mobility such as your AROMs, okay, your AROM exercises. So I hope everyone is familiar, no, with your AROM exercises. And then change position every 1 to 2 hours. Don't let the patient stagnate in one position. So hindi mo siya dapat ang schedule ni patient, hindi mo siya pag-i-instruct nga for the whole morning, mabira-bira siya exercise, pagkahapon, ma-rest siya. So, dapat balot-balot. So, pagka-wake up niya, ma-walk around siya, and then ma-rest, and then ma-walk around naman siya, no? Or sa hapon, pagid, ma-walk around naman siya, and then ma-rest. Kaya hindi nga ang tanan niya nga walk sa aga, tapos pagkahapon, ma-rest na lang siya. So, hindi na siya pwede. Okay? So, dira lang kita, anay. So, we'll have a 10-minute break, no? Before we start with outpatient phase 2. Okay. So you can freshen up yourselves, or if you want sa amo ning break time, so it's 2:30, so we'll be back by 2:40. Okay? I-stop ko lang na para hindi siya tamaan kalawid aton video. And then ma-record lang ko liwat later.